So the first thing we're going to do is etch the enamel margins with phosphoric acid. What etching enamel margins does is provide some surface texture on the enamel for bonding. So I know with a lot of universal adhesives, the step of etching has become optional, but I would always recommend that if you're using a universal adhesive or any self-etch adhesive, that you do etch the enamel margins in this kind of selective etch technique where I am here etching the enamel margins and then I will self-etch the dentin. And that's just because universal adhesives typically are not acidic enough to etch the enamel margins well. So I'm going to rinse the phosphoric acid off, and it's ideal to kind of leave that dentin surface moist prior to applying the bonding agent. I'm applying a universal adhesive here. This bonding agent is going to be applied to the dentin in a self-etch mode. I always get better bond strengths if I self-etch the dentin. And I'm really rubbing it in there pretty well, because when you rub your bonding agent, you're evaporating out your smear layer off of the dentin and really pushing the bonding agent in between the demineralized collagen to form your hybrid layer. One little thing that I'm doing now is I'm going to be blowing on that bonding agent to evaporate the solvent out of the bonding agent. And that's just because the solvent inside your bonding agent really doesn't need to be in there, and it can evaporate later on and leave voids in your hybrid layer. So this last little step here is I'm going to take a clean micro brush and kind of clean off some of the excess adhesive. Light curing your bonding agent is really important, so you want the face of the curing light tip to be as close to and as parallel with the surface that you're curing as possible. Once you've cured your adhesive for the complete curing time, we'll be ready to go ahead and apply our restorative material. So the restorative material we're using is ACTIVA BioACTIVE Restorative. So it's applied out of a dual barrel syringe, so it's got a dual cure function to it. And because of that, I always like to start inserting it down in the bottom of my preparation first, because wherever you insert it first is where the chemical cure is going to initiate, and wherever the material starts polymerization is the direction in which it's going to start to cure. So since we have a self-cure mechanism of this material, I like to initiate that in the floor of my prep. So I'm inserting it in there, just kind of flowing it around my preparation. You can see I'm filling a pretty large size preparation pretty rapidly, so you are going to save some time in the filling, but you'll also see I'm not really carving any anatomy, so I lose a little time because I'm going to have to cut this back. So fast forwarding actually this video because I'm allowing that material to self-cure for a while prior to doing a light cure of the restorative material, and that's just to give some time for relaxation of polymerization relaxation in that period of time where I'm allowing just a self-cure. Then I'll light cure the material because it is a dual cure material, and go ahead and remove the ring and the wedge and the matrix band. So here I've got a matrix band that's coated, and sometimes that makes it easier to get it off because sometimes ACTIVA can stick to metal only matrix bands. So now this is where I have to cut back a little bit, and I'm going to be using a Q finishing crosscut carbide burr, which just makes it a little bit more efficient for me to cut this back. So I start off from reducing the marginal ridge. Now I go through and just kind of roughly try to form some cusps here by going into where I approximate grooves to be. And then once I get those grooves, I'll just go back and forth over cusp tips to try to grind in some cusp tips. And try to do this relatively rough just because I will have to adjust this when I adjust occlusion. I didn't turn the water on when I was filming this just because it was making too big of a mess to have the water on the handpiece. So I'm doing it dry, but in the mouth I would obviously be doing this wet with water coming out of my handpiece. So again, you'll see just kind of following those grooves to try to form some outlines of some cusp, and then just going over the cusp to make them more rounded. You'll see in that embrasure area on the distal buccal, there is a little bit of an area where I have got a little flash. You'll see me try to clean that up right now. Ideally I could have used a 12 blade to try to clean that up a little bit better, and that is one regret I have of this restoration. But this Q finisher does a nice job of kind of just smoothing out the restoration, and of course we'd have to check occlusion and finish up our adjusting. This is some Gorilla Floss. It's some really strong floss that will try to help me clean out that interproximal area a little bit better. But you can see the finished restoration is nice and smooth, and I think the margins look pretty good as well. So thanks for watching along.